Okay. Good morning, guys. This is Christian, and welcome again to the Losing My Mind podcast, the podcast dedicated to all things brain cancer related. Um, on today's show, I want to talk about the symptoms of brain tumors because I've been asked in a couple of private messages that I ever noticed anything before I've said in past episodes that I started having seizures back in May. But I've been asked, did I notice anything in particular before that might have been indicative of a brain tumor? Um, and looking back on it, yeah, I did experience a number of different things, and some of the symptoms are so generalized; it's very easy to overlook them or brush them off as being something else or being something completely normal, which a lot of times the symptoms can be. Um, but for me, and I've read many different articles and different symptoms and even lifelong symptoms that can help dictate whether or not you might become someone who develops a brain tumor. Like I've read, for instance, that people who have insomnia, which I have suffered from my entire life. I've suffered from insomnia since I was a child, and I've also suffered migraine headaches. My entire life until about 15 years ago, where I had a doctor that treated me with a certain steroid treatment, and it completely stopped my steroids. I mean, my migraines in their track. Um, and then when I did have one, I started treating it with Imitrex medicine, migraine medicine, and if I did start to have a migraine, it would knock it out in about 15 minutes, just like that. So I haven't been suffering from migraines for about 10 or 15 years, but I've suffered with them my whole life. Um, but prior to the seizures that I started having, about a year and a half, and it's so weird because it really is hard to say whether or not these things were directly signs that I was developing a tumor or not. But I had started telling a few people closest in my life, my wife and a couple of my buddies and my sister. I had been telling them for a little over a year. I said something's wrong with me. I couldn't pinpoint it. I couldn't even explain it, but uh I started having severe memory problems, like short-term memory problems. Um Not just a typical now and then where you walk into the bathroom or something, you're like, "What am I doing here?" That sort of thing. I was getting a lot of that, but I was also getting a lot of just like somebody would say something to me and I would look at them, I would hear every word they're saying, but I couldn't recall anything they just said to me if you asked me to recall it 5 minutes later. Um, so I was starting to develop a lot of memory problems. Another thing I noticed about a year before my seizure started was I've always been very good at math. I was always very good at doing math in my head very quickly. Um, and a year before my seizure started, I lost that ability pretty, at least a significant part of that ability. It was a pretty abrupt change that I noticed that I could no longer do math in my head very quickly. Um, so that I knew something was happening. Um, and also too, like I had a loss for words. Um, my vocabulary is actually kind of extensive, even though I don't always use all the words I know. But I found myself unable to use the right words in the right situations, and not even sure if that's a symptom, but it was a change I noticed in myself before the seizure started. Um, so yeah, I started noticing something was happening before the seizure started, and up here to the above my head and to the right of my head on the screen, you'll see I've got some generalized symptoms of brain tumors. Oh, and one of them here, nausea and vomiting. I never had the nausea, but I did start experiencing unexplained vomiting um, a couple of months before the seizure started. I would just violently vomit for no reason. I would just get sick in my stomach, walk over to the sink, and vomit down the garbage disposal. Um, I never developed the speech problems until after the seizures. I did have trouble with balance and got dizzy to the point of where I ended up going to a urgent care down this road here, and I was told they thought I had maybe a blood pressure issue or maybe I stood up too quickly or whatever. But I had the room spinning and severe dizziness for about a week, and I was put on some medicine. I forgot what it's called. I still have some in the cabinet. Um, but it did seem to take away the symptoms for a while, so I did think maybe it was blood pressure related, or maybe I moved too fast, whatever. Um, the feeling very tired. When you suffer from insomnia, of course, you're always going to feel tired. So I was always feeling tired, so I didn't think anything about that other than the fact I wasn't sleeping. If you don't sleep, of course, you're going to be tired. Let me see here. Confusion on everyday matters. Yeah, I guess you could say that I had some confusion. Um, but once again, I brushed that off as not having any sleep and just being just severe lack of sleep, which I think could also help cause that confusion. Feeling hungry and gaining weight. Well, if that's a symptom, my brain tumor started 16 years ago after I had kids. Because when my first son was born, um, I weighed about 189, and 16 years later, I'm walking around a nice 250. So if that's the case, my brain tumor is pretty damn old, and my seizures started way too late. But no, I don't think that's I don't think that was one of my signs of my tumor in particular. Um, of course, it says up here the seizures with no history of seizures. Yes, of course, I had that because that's how we discovered my tumor. Hearing problems, I never had any of those. Personality and behavior changes. Um, you'd have to ask my family or my wife about that, or maybe there was some changes. I don't know. I didn't feel like I was. I mean, I was changing too much for who I was. But anyway, so I was asked that question a couple of private messages. Did I notice anything before the seizures that that I or my wife or anybody who was around me noticed? Um, most of the signs that I noticed, my wife and them didn't notice because it really wasn't anything. You know, how do I prove to somebody I can't do math quickly in my head like I used to anymore? Um, but I noticed a lot of my quick witted thinking and stuff like that had left me about a year before the seizure started. So um, and like I said, so many of these symptoms they can be easily brushed off as something completely benign or attributed to something else. I'm not telling anybody to go run and screaming to the doctor if you experience any of these. But if you start going through what I went through, where you know that something's wrong with you, you feel it, you know yourself better than anyone else, then it's probably be a good idea to take some action and get yourself checked out. I'm no one to give medical advice, but I do kind of wish, looking back, when I started realizing something was wrong with me, that I'd taken a. Although my first seizure that I had, my CT scan came back clean, and even my first MRI came back with a slight shadow on the brain that was inconclusive, and so they didn't do another MRI for 6 weeks. And by the time the second MRI was done, my little white shadow on my brain had turned into a solid tumor the size of a peanut. And so it grew extraordinarily fast and did a lot of damage to me in a short period of time. So I guess the sooner you address the problem, the better. Um, but anyway, That's about all I have to say today. And anybody out there who's watching this show, if you have a tumor yourself, I'd like to hear from you. Did you notice any changes, or did you feel anything on the inside that you knew was different about yourself long before you knew you had a tumor? Because I knew for about a year something was not right with me, and that doesn't mean that I'm right about that my feelings were correct. But I'm just telling you that from personal experience and from what I had told others, I had told others for a while that there was something wrong with me, and I ended up being somewhat right. I mean, what's the saying goes? If you tell enough people something's wrong with you, eventually somebody's going to believe you. Well, that is true. If you go to a doctor and you say, "Hey, doc, something's wrong with me," enough times, eventually a doctor's going to agree with you. Uh, so, but yeah, that's about all I have to say on today's show. Is just I was just answering a couple of messages on did I notice anything different? And yes, I did. Um, so I'd like to hear from anybody else, in the comment section below, or anybody who sends me any messages. Let me know if you experienced anything before you knew for sure that you had a tumor. Before any seizures started, did you notice any changes in yourself? And give me some feedback on that, because I'd be interested to know, what you experienced and how you knew that something was different. Um, well, that's all for today's show. My wife and I, we have taken one day today. We're going to go to Myrtle Beach and get out of here for a day. It's a much needed long way to break. It's been a really, really rough 3 months, and unfortunately, we have some terrible weather, but we're about to drive into, so it doesn't look like we're going to have some really good walking on the beach weather to get out and absorb some sounds and smells of the ocean. But we're still going to go anyway and get out of here for a little bit and relax as best we can. And let me step away from this computer and away from this house and just try to de-stress for a little bit. So I'll see you guys when I get back. And until then, I hope you all have a wonderful day later.